Hi everyone, welcome back to my page. Please subscribe, follow, like, and comment. As we all know that the year is going to an end very soon, please let's try our best to be kind to those around us, give out to the less privileged. The bottom line is be kind to people. Remain blessed as you do so. So today I'm going to be discussing on how to boost your libido, the cause of low libido, the treatment, and so on. This low libido of a thing has caused so many problems between couples. So libido, which means sex drive, or the desire for sex varies dramatically from one person to the next. It also varies depending on a person's preference and life circumstances. Libido can be affected by medical conditions, hormone levels, medications, lifestyle, and relationship problems. Many new couples will go through an early period of having a lot of sex that then decrease over time. On the other hand, a busy life can leave some people too tired or preoccupied to even think about sex. Unless you're worried about your sex drive or it's causing problem between you and your partner, you do not need to seek professional help. So, my dear people, what is a normal libido? There is no right or wrong level of libido, and there is no normal when it comes to how often you have sex. Some people have sex or feel like having sex every day. Others may have sex once a year or not at all. It all depends on what you prefer and your life circumstances. So, what causes a lowered libido? As well as medical conditions and side effects of some medications, there are a number of other causes of lowered sex drive, and these include performance anxiety. Premature ejaculation or painful sex can make a person avoid sex out of fear that it could happen again. Another thing is fatigue. Feeling too tired for sex is very, very common. Another one is lack of time and privacy. The demands of work and home life may not leave enough time for intimacy and sex. Another thing is familiarity. The couple's desire for sex tends to lessen over time. Another one is sexual incompatibility. Sexual desire can be affected if a person constantly wants more sex than their partner or wants a type of sexual activity that their partner is not comfortable with. Let me explain further about this. In some relationships, some guys want to do doggy while other partners don't because it's painful to them. Some love oral sex while their partners don't even appreciate that at all. So this leads to sexual incompatibility. Another one is sexual turn off. Sexual attraction to your partner may lessen if there are changes in the physical appearance, such as excessive weight gain or being dirty. Some ladies will not even shave and still demand for a head, and vice versa. So make sure you are always clean. Get some nice perfumes. Make yourself attractive to your partner. Failure to do all this leads to sexual turn off. Another thing is depression. Mental health conditions such as depression can cause tiredness, lack of motivation, feeling sad and withdrawing from activities, including sex. Another one is stress. See, researchers have found stress hormones can lessen sexual desire and response. Another thing is exercise and physical activity. Either too much or too little physical activity can cause a loss of sex drive. Past traumatic experience also. Going through trauma such as sexual harassment, sexual abuse, or rape can impact sexual desire. Can relationship issue affect libido? That's another thing. A reduced sex drive may also be caused by relationship problems. If a couple is having problem, in their areas of their relationship, their sex life may be affected. If you and your partner are not satisfied with your sex life, you can seek professional counseling too. Learning communication skills to improve the overall quality of your relationship. Try to resolve underlying problems such as tension. Another thing is learn how to increase intimacy and physical affection without having sex. Not every time you have sex. Learn different sexual techniques. Learn different sexual techniques. Talk about sexual desires and fantasies together. Learn strategies to boost sex drive, such as masturbating and fantasizing. Can health issues affect libido? My dear, I will tell you a reduced sex drive can be a side effect of some medications. For example, some antidepressants have a known side effect of lowering libido. Some women feel they have less interest in sex when taking contraceptives that contains hormones such as the pill. Some physical illness and medical conditions can cause a loss of sex drive, including anemia, kidney failure, hypothyroidism, and depression. Now, if you are worried about the effect of medication on your sex drive, you can talk to a doctor about changing medication or trying alternative options. Now, I want to tell you conditions affecting female libido. Conditions affecting female libido. Some of the medical conditions that can cause a woman's sex drive to lessen include number one, menopause because of the drop in sex hormones. Number two, uh, painful sex. Painful sex. Vaginismus. Vaginismus, the involuntary clamping or spasm of the vaginal muscles, making penetration difficult, if not possible. I have discussed vaginismus in my other video. Another thing is pregnancy, childbirth, and breastfeeding because of changes in hormone levels, especially the hormone prolactin. Another thing that can cause problem is infection, such as thrush or urinary tract infection. Now, problems reaching orgasm is another one. The woman cannot reach orgasm or reach it within the time wanted by her and the partner. Conditions affecting male libido. Some of the medical conditions that can cause a man's sex drive to lessen include number one, hormone changes. Hormone changes. See, as a man ages, his testosterone levels slowly fall. It drops, which some researchers think it is likened to a lessened libido. Another thing is impotence, not being able to achieve or maintain an erection needed for sex. Premature ejaculation, a lack of control over ejaculation, causing it to happen sooner than the man or his partner would want. Guys, let me teach you something. When making love to your partner and you feel you want to come, stop. Play with her by touching all sensitive parts of her body. By doing this, your testis, which is responsible for sperm production, will be relaxed. At that moment, then you can now proceed. Another thing is retarded ejaculation, not being able to reach orgasm. That's what I mean by retarded ejaculation. And how is lowered libido diagnosed? If you have lost interest in sex for no apparent reason, the doctor can help find the cause by carrying out a range of tests, include physical examination, medical history, blood tests. How is lowered libido treated? I would tell you that treatment for a lessened sex drive depends on the cause, but can include treatment for any underlying medical condition, such as depression, although a side effect of some antidepressants is a lessened libido. Another thing that could help for the treatment is counseling. Counseling. Another thing is stress management. Learn how to manage your stress. Another thing is hormone therapy. See, my dear, in summary of what I'm just telling you, in summary of what I have been saying since is sex drive, your libido varies a lot from one person to the next, and there is no right or wrong level. It's normal for a person's libido to fluctuate, go up and down, up and down, up and down, and there may be many reasons for this. If a couple is having problem in other areas of their relationship, their sex life may be affected. So medical conditions and medication can affect a person's desire for sex. Treatment for a lowered libido can include treating an underlying medical condition, hormone therapy, stress management, and counseling. So